And I'm just going to make a tiny little hole. All right, here we go. It's so sad when this happens. This is like a sidewall blowout on a tire. All right, look at that. Woo! Hey everybody, I'm Dr. Barrett, and we are here today to explain to you my suture technique. And the way we're going to do this is we're going to cut open some implants and see what happens when I try to suture it back together using my fancy plastic surgery closure techniques, okay? So we have a smooth silicone implant, we have a textured silicone implant, and then for the grand finale we have a saline implant. So we'll see if we can actually make this watertight again with just suturing technique. When it comes to breast surgery, the breast has 5 layers, and when you bring those layers back together very precisely, you get much less scar tissue, right? So scar tissue is when your body is trying to fill the gaps. So if there's no gaps in there, your body doesn't have to put scar tissue in it to fill it. I'm not going to be able to show you 5 layers here, but I'm going to kind of show you some of the meticulous things that I do with suturing. I only use black and black instruments. These are really expensive instruments, and if you look, they're super, super tiny teeth that grab the tissues very delicately, and I don't pinch it very hard. Let's get on to cutting open some implants. So the first one we're going to start with is a textured gummy bear implant. This is a Mentor implant, 500 cc's, moderate profile plus. We're going to cut it open and see what happens. All right. Woo, okay. So we just made our cut, and you can see this. You see the gel wants to come out right here. So that's a problem. This highlights is actually the advantage of these gummy bear implants. So this is actually, even though it is cut, it still stays together. It's just a cohesive gel implant or gummy bear implant. So we're going to suture that up right now. I'm going to do what's called a locking suture. And for those of you in the medical field, this is a very secure way. We do this sometimes in the mouth or in the scalp to prevent bleeding. So we're going to start this up, and we're going to take my suture abilities to the test. All right, guys, we're on our last stitch here. I'm going to tie it together, and I'm going to kind of say a prayer to the implant gods. All right, now guys, we have not tested this out. So, all right, here we go. Check it out. It's not popping out anymore. Success. I'm going to set up a new suture here. We're going to try something a little more difficult because it's never exciting unless you actually fail. So we got our new suture ready. We've got a backup suture here. All right, so we're gonna do the smooth silicone now, and I'm just gonna make a tiny little hole. All right, here we go. It's so sad when this happens. There we go. Okay, so we got this is like a sidewall blowout on a tire. All right, look at that. Woo! And this one we're gonna do an interrupted closure. This is what I typically do for most of my breast surgeries on the final skin layer because I can really reapproximate the tissue. And this is all for fun, guys. Don't try this at home. Don't try this on your implants in your body, okay? Okay, we're almost done here, guys. This is an interrupted suture. Thank you, doctor. Okay, all right, so this is closed up, you guys. Let's test this out. We've never done this before. Wow, I'm putting a lot of pressure on this, guys, and it's holding up pretty well. That's a pass, because that's not falling all over the place. So we got technique 1, locking suture. We got interrupted suture right there. I think this is actually working better than that one. And then the last one, the most difficult, challenging one of them all, is the saline implant. I'm gonna have to position this. So this may not even happen, you guys. We never tried this on a saline implant. I'm gonna make a tiny little hole, and saline, as you know, is a liquid, and this has a propensity to leak right out if we're not careful. So I'm gonna go ahead and cut this open. Okay, so we now have a hole, and that will definitely leak. So I'm going to try to suture this up while holding it together. All right, so this one I'm going to have to probably hand tie. Yeah. Woo! All right, so the benefits of being a general surgeon is that you have to learn how to hand tie. And I occasionally, if any of my general surgery colleagues are looking at this right now, I feel like I'm under the gun. What did I sign up for here? So I did a running suture on this one. And I'm gonna have to tie this up. I gotta do one more loop. So we did a different suture on this. And I kind of like running suture. They actually did studies on running sutures for hernia repair or for fascial closure, and they found that running sutures can handle the stress of the wound better than interrupted because it can distribute the tension evenly. So for all you surgeons out there closing fascia, running suture is the way to go according to this one study. You guys, I'm getting excited about this. It's actually looking very promising. So we got our saline implant, you guys. Let's check it out. All right. So it's leaking. I did my best, you guys, but I'm not a magician. All right, so we do a close up here. You can see leak, leak, leak. Pretty good though, you know. You can get by in a pinch, slow it down a little bit, but still leaks a little bit. That's it, you guys. We just finished cutting implants with scalpel and closing them up, all right? So we did a pretty good job. We did 3 different suture techniques. We have a textured, saline, and smooth silicone implant. Different suture techniques. Did pretty good on the silicone cohesive gel implants. Interrupted suture here, very minimal poke through there. This locking suture is rock solid for the textured implant. And then for the saline implant, we have a running non-locking suture with a little bit of a leak. So watch out. That's it, you guys. If you have any more questions about my suture techniques or my breast surgeries or any of the stuff that I do, please check out my website, drdanielbarrett.com. Don't forget to leave your comments, questions, feedback right here on my YouTube page. And if you like what you saw today, don't forget to give me a thumbs up and subscribe if you want to see cool videos, more cool videos just like this. Thank you, guys.